I'm going to get us started here. Just some reminders for the event as we get going. This session is being recorded and we'll have it available on our website for a limited time following this event. We have closed captioning available as well in the CC box at the bottom of your screen, and we have ASL interpreters available who will be shown throughout the webinar. You're welcome, of course, to be using the chat to participate in the conversation throughout the webinar. Please make sure that you have your chat setting to everyone. That way our panelists and us staff are able to see and converse with you. We also welcome you to use the question and the Q&A box at the bottom of the screen to post any questions that you have throughout the webinar as our speakers are talking, answering the questions that we have here to guide the discussion. But we'll have some time at the end for you all to have some questions answered as time permits. And then lastly, we'll have a evaluation sent to you at the conclusion of this webinar. We ask that you please complete it. It will only take about 3 minutes and will be super helpful for our organization to continue to provide, really cutting edge and helpful programs like this. My colleague Miriam here has posted that in the chat, so you can have that ready to go at the end of this. The agenda that we have for today is laid out here. After I wrap up this slide, I'm going to hand it off to our CEO and founder, Erin Luce-Cotrero, to talk about She Should Run and our new work on the issues. We'll get to meet our speakers and have Erin moderate a really robust discussion about reproductive health in America and the various lines of work from which our speakers come from. They'll be answering questions from the audience as well at the end, so be sure to include those in the Q&A box throughout the discussion. And then we'll be wrapping up this webinar with some exciting next steps for what you can do in your own communities and with She Should Run. So without any further ado, I'm going to hand it off to Erin.
Hi, everyone. Thank you for being here. Thank you, Sophia, for kicking us off there. I am Erin Luce-Cotrero, founder and CEO here at She Should Run, and I'm going to just speak for a little bit before we turn it over to our incredible panelists to have the discussion we'll have today. I wanted to, before we get too far though, tell you who She Should Run is, where we sit in the space, and hopefully that will kick us right into the conversation. So know that She Should Run is a national nonpartisan nonprofit working to get more women to see their potential in elected office. I will explain what that looks like when I explain this wonderful funnel that you're looking at right now. But before we do that, we're going to jump right into a little activity for you all. We're going to do a poll on what best describes you today when considering running for office. There is no wrong answer here. This is what we do at She Should Run often, is just get a handle on where folks are in terms of their interest or curiosity about running for office. It's okay if the answer is not interested at all, not considering at all. It is okay too if you are serving in office. The great news is this conversation will be relevant to everyone, but we'd love to just see where you fall. So give everybody just another minute to answer that question for us. Fun fact, this is kind of how we start everyone in our community in understanding what we describe as their mindset. Okay, great. So know that I love this. I have not considered running for public office. And I've put some thoughts towards running for office, representing the bulk of you all here. And in fact, that is She Should Run's sweet spot. So we call that low mindset scores in our organization. We love the folks who are here who have already thought about it or who are serving as well. Our programming, however, often serves that woman who is not quite there yet. So what you'll see in this funnel on the screen is hopefully a visual that will help us make more sense. Many people think about the space of getting women to think about a run for office or supporting women running for office as what is at the bottom of the funnel there, that I'm running for office now. when in reality, there's this whole invisible space, prior to She Should Run, it was invisible, that happens before that, where women are often not thinking about running at all, sometimes sort of curious about it, but don't know where to go, and sure as heck aren't going to sign up for, a fundraising or media training yet, because they're not convinced it's a good use of their time. The reality is that, the work of She Should Run is often digging into the motivators, what it takes. And we did research last year, new research that dove really deeply into what will motivate women who are not already wonderful problem-solving women. Many of you are on this line right now, who care about something but aren't thinking about running at all. What's going to motivate them to step into the space? The big takeaway was women aren't a monolith. There's a whole host of things that will motivate women, and it sort of depends on background and experience, but there was one through line, and that was that if we can show up in conversations that women are already having about the issues that matter most to them, that is how we are most likely going to engage a community that is not already in the space of running for office. And so what you'll see in this funnel here on the left side there is reproductive health and gun violence and climate change and economy and racism. These are the top issues that have been identified as not the only issues that women care about, but the top issues that women are thinking about and happen to disproportionately affect women. Today's conversation, by the way, Miriam, I know she posted, there's a full report that we did on our thinking here called the group chat issues report that you can read more about in the chat section there. So the second question that we want to ask you, though, as we lead into this very important conversation, we're at the week that is 1 year after the Supreme Court overturning of Roe v. Wade. Wanted to just get a gut check from you all, just real-time polling here. What direction do you think reproductive health in America is headed? I'm sure there are other responses here, but we're going to keep it simple with these three. Going backwards, we're stalled, we're making good progress. We'll flip that around. Okay, not surprised, not surprised to see there specifically in telling that no one here who took this poll thinks we're making good progress. The good news is we'll talk about some of the progress that is being made. It is important to know that there are important actions that are being taken, important steps moving us in the right direction. But I hear you all on feeling really, it is a really challenging time around the work for reproductive rights. So with that, let's get to our amazing speakers who can tell us more about the state of this issue and their work specifically. I am going to have each of our speakers go ahead and come on camera. I will just name who all the speakers are, and then I will turn it over to the speakers to do quick introductions of themselves. We have Aisha Clark, who's the Executive Director of Health Equity Solutions based in Connecticut. We have Michigan State Representative Laura Pohusky, who we're grateful to have here with us today. We have Lupe Rodriguez, the Executive Director of the National Latina Institute for Reproductive Justice, who thankfully also co-hosted with us today. So I know we have some amazing supporters of that organization on the line. And I wanted to give a shout out too for one of our panelists who unfortunately had a last minute emergency conflict this morning, Rochelle Garza, who is the president of the Texas Civil Rights Project, and she was also a 2022 candidate for the Texas Attorney General. We have more conversations to come with Rochelle. Unfortunately, she can't join our conversation today, though. So with that, why don't we start with Representative Pohusky, please, to introduce yourself.
Hey there, everybody. My name is Lori Pohusky. I serve in the Michigan legislature. I'm in my third term, and I currently serve as the Speaker Pro Tem, which means I am primarily the one presiding over session, which is both the most fun and the most frustration I've probably ever had. I was previously a microbiologist. I ran for office because I wanted to bring a scientific perspective to the legislature. It was something that was sorely lacking when we look at things like environmental policy and reproductive policy. Reproductive health was a huge reason why I ran. I was one of those folks who post 2016 had to reconsider my birth control plan because suddenly there were people who were not only taking a keen interest, as they always had, in my reproductive health choices, but they were also giving themselves a lot more power. And we saw the writing on the wall. And I remember feeling incredibly violated that I was having to make a choice other than the one that I was, comfortable with and had been using for years because the birth control mandate was up for grabs now. And I knew that I was far from alone in that position. So I ran for office because I thought that we needed younger leadership, more female identifying leadership, and just people that were sharing in these concerns. So I ran in what was thought to be a very anti-choice district. And I think a lot of folks were surprised when it turned out, no, lo and behold, this historically conservative district was very much in alignment with bodily autonomy and being able to make their own choices over their bodies. So it was a learning experience for a lot of folks here in Michigan. And obviously there's been a lot of changes in Michigan since then. So I'm grateful to be here with everyone and excited to talk about this topic a little bit more.
Excellent. Thank you, Representative. Lupe, can you go next?
Yes, thank you so much. Thank you for having me today. I'm really excited to join you all and to be in the company of these incredible panelists. As mentioned, I'm Lupe Rodriguez, the Executive Director of the National Latina Institute for Reproductive Justice. And I have been working in the reproductive justice, health, and rights movements for 16 years now. Before my work here at Latina Institute, I worked with Planned Parenthood Marmonte, which is the largest Planned Parenthood organization in the country, based in California and working in Nevada as well. And then before that, I ran an abortion fund in California. So I have and worked as a volunteer there and worked to house women who were coming from different parts of California to receive care in San Francisco. And who needed support and practical care. So I have a pretty wide breadth of experience, but I'm also, I come to this work as a trained scientist as well. So I'm happy to hear that, Rep. Pohutsky. I trained as a neurobiologist and really feel and agree that I think bringing that perspective to our work, really being data-driven in how we approach what we're doing is really important. And I think a way to move forward in how to solve the problems that we're confronting. I think I'll say that, in my experience in this movement, many people in my community, I've recognized this for a long time, that many people in our communities have not had access to care even before the fall of Roe versus Wade. And so I think the issue now and the goal now is to strive for a future that's different than what we've had before. It's something that we've never seen, and really thinks about full access for everybody and all of the different and confronting all of the different barriers that have kept many people in our communities from having real care and real access. So anyway, I'm really excited to have this conversation with all of you and really excited to connect with you about how we can make change right now.
That reimagining is a beautiful thing to think about. Aisha.
Good morning, everyone. My name is Aisha Clark. I am the executive director for an organization called Health Equity Solutions. We're located in the state of Connecticut. And as shared, I am the executive director there. We are an organization that focuses on advancing health equity through anti-racist policies and practices. And we really strive in order to ensure that we're making system level changes within our state. One of the biggest things that we pride ourselves in is really hearing from our community and some of their needs, and really hearing from them and how we can solve some of the issues that they're encountering. And we take that information and really do some advocacy work at the administrative and executive level. Prior to coming to Health Equity Solutions, I did run. So I was the She Should Run. So I did run for office myself. I started off at a local level. I'm a local politics matter person, and I ran for our Board of Ed. And I really ran on the same grounds on what we do at Health Equity Solutions, is really making sure that I'm hearing from the community. And I felt that I had the charge of really standing in the gap for those who felt like they did not have a voice or did not have the ability to run for office, whether it's careers or they felt like they couldn't be heard. So I wanted to be that liaison between the community and really shift policies. The work that we do here and that we're talking about here, I'm really excited to be amongst amazing panelists as well. And at Health Equity Solutions, we talk about making sure that individuals can have optimal health regardless of their race, ethnicity, and socioeconomic status. And with that work, we know when it comes to reproductive health, it really affects Black and Brown individuals at its highest rate. And so making sure that we are, again, we'll use that word, reimagining what this looks like, but also really dismantling a lot of the systems that are in place and shifting that so that individuals can have access to optimal health. So thank you so much for having me be here, and I look forward to this great discussion.
Oh, I have chills. I think just having the breadth of experience that you all bring and expertise that you all bring to this conversation is so important. And hearing too, I think where we're going to go in this conversation is not only what we're seeing in the energy, but what we can all do, right? How do we all need to show up to do the very thing that we're talking about, which is not just hold on to what the past provided, but to reimagine a future that really does provide for all. So with that, I'm going to turn to some questions. And we had so many audience questions come in, and we tried to do our best to take, just in registrations, we tried to do our best to take the questions that we got in advance and form the questions to the panelists, and know that you can still submit questions through the Q&A tab at the bottom of your Zoom. We'll do our best to get to as many as we can, but also hopefully honoring some of that in what you hear ahead. So I'll start with the representative. So Representative, I'm curious, so a lot of the conversation happening at the national level is charged. It can also often feel like we're at sort of a point of paralysis, like you just don't even see where the progress, any potential for progress is happening, when in reality that you see at the state legislative level and even at the local level, actions that are being taken now, laws that are being changed now. I'm curious, in your role, obviously at the front lines of this, what are you seeing in terms of energy for this, and what are you most hopeful about in the changes that you are leading?
I think that reproductive health, reproductive justice is one of the most energizing issues that we have in Michigan State Legislature right now. One of the first bills that we got signed into law was a repeal of our 1931 criminal abortion ban. We had one of those zombie laws on the books. And I will acknowledge we're in a really unique and fortunate place, because in 2022, we had a ballot initiative to actually provide a constitutional right to reproductive freedom in our state's constitution. So the grassroots organization and the folks who worked on that really did help us with a lot of the momentum around this. So it also kind of laid the groundwork for some of the conversations that we knew we were going to need to have. But it also kind of gave us our marching orders, right? So we have this fantastic constitutional protection, but we also have trap laws on the books that still limit access, even within the framework of that constitutional right now. So it gave us a really clear pathway to what we needed to do. And also because we knew who worked on that amendment, it gave us resources to figure out how to best do this. What are the top priorities of things that we need to deal with? And it's really helped keep that energy up in the legislature. And what I will say is, like, when we go back home, this is something that's discussed with me at virtually every coffee hour, every town hall I have. This is not an issue where people are losing sight of it. It is still a top of mind issue for people. So it's really easy to maintain that momentum and that energy when we are here at work, because it's something that everyone is being reminded of virtually constantly, because they see what's going on in other states, and they saw what happened even here in Michigan with Roe v. Wade. So it's a really exciting time.
I'll pass that, Lupe or Aisha, if either of you want to jump in on that question. I'm curious of, it is a question that we get often, just in conversations, I think, happening at the national level, is like, where is the energy for this issue right now? And you hear locally, the energy is there. You hear, faced with what feels like paralysis at the national level. I'm curious if either of you want to weigh in on what you're seeing.
Yeah, I mean, I can share that. I think it's very clear, and it's been made clear in different elections cycles so far, since the fall of Roe versus Wade, that communities are interested in protecting access to care, and we've seen that through polling as well. The majority of people in this country support access to care and are also interested and willing to go out and vote to protect that right. And specifically in the Latinx community, we know that there are a lot of myths about where the community stands on this issue that are untrue, really. Over 60% of Latinx voters support abortion access and have said that they would come out to vote in support of candidates that support abortion access and on ballot initiatives, for example, that would support it. So I think certainly in terms of the voting public, the energy is to protect care, and I also think that folks, we've seen on the ground that folks are organizing around this, that they're motivated by it, that they're really thinking about how we also change hearts and minds and do culture shift within our communities to be able to not just again secure our legal right to this care, but also to have kind of lasting change around this that will never allow for us to have it taken away again.
Hear, hear.
And if I just might add to that, the only thing, especially in the state of Connecticut, what we've seen as a local growth for individuals to do advocacy work, and then some state laws that were put in place specifically to help support and protect access to care. Once the overturn came, Connecticut, we became a safe harbor place. And so it was important for the state of Connecticut to understand that we are not going to deny care, and that if individuals were coming to the state of Connecticut, that they would be safe here. And that was a push from the public. It was definitely, obviously, our legislators understood the importance, but they take pride in listening to their community as well. And so we do hear from the local and the state level as well here in Connecticut.
So helpful to hear that the organization and the fight has to happen, but it's also, I think, so important to continue elevating the stories, the many stories, and its majority of stories of individuals who are stepping up to take action right now. Aisha, I want to ask a kind of a follow-up question for you. So much of the conversation around reproductive health does center, especially the national level, specifically around abortion. And what's not talked about enough is when those reproductive health clinics close, women can't get cancer screenings, they can't get prenatal health care, they can't get gender affirming care. And that's especially true for women of color or women from low income communities. What do you think we need to do, or what's your vantage point on that to bring attention to those ripple effects?
Thank you for that wonderful question. So I also want to add to that point, like you said, gender affirming and also trans men, all of those things are important as well on the ripple effect. The best way to bring attention, and what we have seen is that, and I'm sure the state representative will have this, is make some noise. And when I say make some noise, is making sure that you are working together with the campaign to really identify what the issue is, and then come up with some solutions, and make sure that it's community driven. So it's one thing about going into the community and surveying, saying, hey, what would you like? it's another when they feel like they are part of the process. And so one of the things that we found out is that when you move towards a transaction, when you move from transactional work to transformational work and making sure that it's community driven, then you can actually see some substantial changes. And so bringing awareness is making sure that there is a true campaign around that, bringing organizations and individuals together with lived experiences and valuing those lived experiences will have an effect. So making sure that they're in a space of going ahead and being on calls, making phone calls, talking to the legislators, telling them, here are some of the things that are happening. I'm being, with the closing, let's just say, of clinics, I'm not having access to clinical screenings, pap smears, cervical cancer screenings, all of those things, especially in our Black and Brown communities. We know that access to care, especially in the state of Connecticut, is at its highest, its lowest rate. The state of Connecticut is identified as one of the healthiest states in the nation. However, we're also, if you pull back the onion, we're also have a lot of challenges when it comes to access to care for Black, Brown, and the intersectionality of trans and all of the other things. And so making sure that we're addressing those issues by hearing from those who are impacted and allowing them to talk about their experiences and what happens. When that happens, we're able to bring attention to those who can make system level changes. The other identification we have to use, and we're now in the world, I didn't grow up in the world of social media. However, it does have an impact. But making sure that we're sharing and talking about things that are relevant. And so it's best on, what we say is check the facts and making sure it's right, but making sure that we're sharing information to all levels, whether it's on social media, making phone calls, billboards, signs, all of those things, but making sure it's community driven with facts to initially change and have system level changes are some of the things that I would recommend.
So helpful. And I'm curious if either of other panelists want to speak to the importance of that community driven change. And I think just to add a point to that, knowing that a lot of the folks listening, I think the number one question that we got is like, what can I do? And understanding how to connect the dots between how important that community driven change is and the folks who are here today saying, what can I do?
I think that, I want to echo everything that Aisha said about ensuring that we're lifting up the stories of folks who have the lived experience of being impacted by these injustices at the fore. I'll also say that I think it's incredibly important to think about transforming the systems that we have, right? And so sort of looking beyond how we sort of work within what we have and think about and dream about transforming those futures. I think, being able to support and cultivate storytelling and supporting folks in telling their own stories is really important. But I think it should come with like training and other kinds of support for folks to build their power, right? We have inherent power, but many of us, for various reasons, right, don't have access to systems of power, don't have access to develop that. And so I think programs like She Should Run, programs like, folks who are doing training and support on the ground to really connect people to how to make change are really important as well in terms of being able to channel that energy.
Absolutely. And from a legislative perspective, I don't think that we are doing our job fully if we are not actually consulting with people who are, one, doing the work and are impacted by the laws that we are trying to create. That is giving ourselves lip service and patting ourselves on the back without actually addressing the problem. And, one of the things that I talked about repealing that criminal abortion ban. That's fine, but we still have communities all across the state who cannot access the care that is now constitutionally protected for them in this state. Be that because they live up in rural Michigan and they can't get to a clinic, whether it's for abortion care or some other reproductive form of reproductive care, or because we require 24-hour waiting periods now. So if you are someone who has to take time off work and not get paid for that, or doesn't have transportation, because we have horrendous public transportation here in Michigan, we have now made this a 2-day process for you. So, not kind of sitting back and just applauding ourselves for doing the bare minimum, but actually talking to the people who are impacted most by the situation that has been created by the Dobbs decision. And what we're doing here is crucial. And those voices are so, so important. And so are their stories.
Oh, yeah. And, it makes me think too, it's sort of the same issue that we see as women are thinking about running for office too, is if that fire in your belly, if it's around reproductive health, making sure that even in your sort of exploration phase about it, that you are connected with communities that maybe don't look like you or different lived experience than you, so that you can be that stronger advocate when you are in that position of power. It's so important. Aisha, I see your hand. That's so
Yeah, I just wanted to add one other thing. Representative had me think about. It's also a space of sharing power. And there are times where shared power does not happen. And so while we're listening to communities, and Lupe said it too, it's making sure that when we're setting tables to hear from those who are impacted, that we're enabling them and giving them the opportunity to not feel intimidated by who is at the table, but creating a space just for them so that they can be heard, and then provide the training and the support to get there. Because it's one thing to have work groups and say, okay, they're helping and they're informing. It's another to have a working work group that has shared vision, shared goals, shared responsibilities, so that power can be there and then a change can happen. So it's like really pushing that community driven part. So I just wanted to emphasize that shared power as well.
So important. Lupe, I'd love to turn to you, and I'm going to read this out so I don't get it wrong. I was struck by just the enormity of this number, that close to 6.5 million Latinx people between the ages of 15 and 49 live in the states. There are 26 states that have banned or likely to ban abortion. I'm curious, when the conversation that's happening, the dominant conversation, doesn't bring attention to the disproportionate effect on the Latinx community, what are some immediate low barrier actions that you think folks need to take, should be taking, to change that reality?
Thank you so much for this question. I'm always excited to talk about like ways to take action and what we can do. But I'll step back a little bit and share that, this study came about at Latina Institute with the National Partnership for Women and Families, because we really wanted to get a sense of what is happening with people, right? Like there was not a lot of information and data. And so I think to start, right, like that effort to ensure that we're getting the information about what is happening on the ground is really, really important. And at Latina Institute, our focus is working at the federal, local, and state levels to advocate for federal legislation and administrative policy change. But we also, couple that with deep organizing that we do in bases in Texas, Florida, Virginia, and New York, and some virtual organizing where we're working to train activists, who we call our poderosas, to build their power as advocates and leaders, and really, one day maybe even run for office, right? So folks who are going to change the systems that we have. But really, our work to be able to do that, to be able to lift the impact of this really started with finding out what was happening. And so now that we have this information, we've been talking about it widely. We've been trying to lift it up with elected officials, with community members. And one thing that folks can do, first, one thing that folks can do right now is to talk about this, right? To lift up this information that exists, to share it with your networks, and to really amplify it whenever you can. I think it's in all of what we're talking about, it's critically important to share, individual stories and what's happening across the country. There are so many stories about the impact of this, but it is also important to not lose who's most impacted and where it's most impacted, so that we can ensure that resources and support and information are going there. So I think that that's the first thing. I think second, it's really easy for folks to get in touch with their local representatives, as I'm sure a representative on the call can attest. You know, a specific thing folks can do is go to usa.gov, enter your address, and find out who your representatives are if you don't know. And their contact info is there, so from the federal to the very local level. And it's critically important for folks to be in touch with them, to tell them about the issues they care about, to lift these things up. And you know, they take notice, right? They know, they hear their constituents. And so I think one of the things that we often don't do once we've elected someone into office is actually keep in touch with them and talk to them about what we care about. But that is, I think, a really critical part of being able to see change and being able to hold our electeds accountable for what we, you know, what we value and what we want. And then third, join us at Latina Institute. I mean, I think we have a solidarity pledge that you can find at latinainstitute.org. You can follow us on social media. We're organizing with folks right now around the country to raise these issues to the fore, to get the attention they need, to advocate with our federal legislators. And, you know, we have many events over the summer where folks can get involved, but I think those are some key things about this particular issue. And then, of course, looking at your local community and how you can help. I'd be remiss if, as a former leader of an abortion fund, I didn't plug being connected with local abortion funds and really kind of connecting with the resources and supporting, you know, growing the resources that exist for people and communities to be able to get the care they need. So those are some ideas.
Oh, Luba, so many good actionable tips there. And I'll add for folks, anybody, and I know we have advocates who are participating today, please feel free to drop, if there's, you know, there's something that you want to sort of draw people to, a place to take action, in the chat. I encourage you to do that. I think the most important point is not to assume, and we hear it so often, that somebody else has got this, somebody else is going to do the work. Reality is you are that someone. So it is on you to big or small, take the actions. And all the actions that need to be taken. You know, it was interesting. This morning I saw a headline, I think it was in the Chronicle of Philanthropy, calling on donors to switch their mindsets from short-term to long-term thinking around work around reproductive care. And I mean, those of us who, you know, and work in the space, engage with the space, know that it's always been the case, but there is this need of, the work is hard and it is a long game and it's hard to see the wins. I'm curious, Representative, you shared at the start the massive win of the repealing of the state's 1931 abortion ban law. I'm curious, what wins do you feel like you sort of lean on? And it could be that, I know in some previous conversations you shared other, just personally, like what keeps you going? Because sometimes it's not the big huge thing. It might be just that one conversation with someone.
Yeah, exactly. I mean, look, there are legislative wins that, you know, we can go back and look at, but in some ways I feel like those are almost personally more short-lived, because then you come to work the next day and it's a horrendous day and you're dealing with all kinds of stuff. But the more like one-on-one things are actually way more impactful and keep me going on the bad days. When I first ran, I ran in 2018, and that was the year that we had I hate using this term, but the pink wave. And there were a 10 more women that ran, and there were a ton more that won. But my objection to that term has always been, pardon my language, we worked our asses off for it. We had to work that much harder because we were interrogated and we were assumed to not know what we were talking about. So, you know, I think that there were a lot of reasons that more women won that year, but I don't think it's just because we were women. But so the following year, we were doing legislative doors in my district, which is literally, we just show up on people's doorsteps and say, what's on your mind? Here's what we're working on. You know, what are you mad about? What are you concerned about? What questions do you have? What have you seen on the news that you want to talk to me about? Meeting people where they are. And a woman stopped me and she went, wait, can you just stay right here? And I went, yeah, absolutely. And she came back with like a kind of like scrapbook thing of newspaper clippings. And it was about me, and it was about our state senator, and it was about the governor, and all these other women who had run for office and won. And she said, I want you to know, I cut these out and I keep them to show my granddaughters, because I want them to know that they can do anything in this world that they want to. And thinking about that, and thinking about the fact that like those granddaughters are never going to think about like, oh, she had a really bad committee hearing that one day, or she could have answered a question better. They're going to remember that their grandmother felt compelled enough to save these clippings about people who were, you know, overcoming adversity and, you know, staring sexism in the face and doing a thing anyway. That's what's going to matter to them. And that's the big picture. That's what is helpful on rough days.
I feel like I just have to stay on the joy for a minute. Lupe and Aisha, do you have any small or big stories that you want to share that help keep you going?
I think that's so real too. You know, when you're confronted with the sort of avalanche of legislative setbacks that you know my team and I have experienced, like in Florida and Texas in the last year alone, when you're sort of, you feel like you're sort of pushing against a movable wall. I mean, it's incredible to think about just like the everyday stories of folks who are coming through, for example, our programs at Latina Institute, and are able to advocate for more streetlights in their neighborhoods, right? Like wins like that. Thinking about, you know, we have this saying here at Latina Institute that was coined, and that was started by one of our activists in South Texas in the Rio Grande Valley. That's "Aquí se respira lucha," which means "here we breathe resistance." And it's kind of born from the idea that they've faced so many barriers, so many issues, even before, again, the fall of Roe versus Wade, so many inequities. And yet there's still this brilliant kind of fight and spirit and energy around making change, and a belief at the end that we'll get there. And so I get a little emotional when I think about that, because I think that's the kind of spirit that we have, in optimism in a future that I think will be better than what we had with the Roe versus Wade protection and beyond. I mean, I think there's so many issues around health equity, you know, as Aisha was saying, about really ensuring that folks actually have access to care that helps them set themselves up and their families and their communities for health, dignity, and justice. And so I think I feel that energy every day from the folks that we work with. And I think that's part of the joy and the spirit that keeps me going.
And I'll say for sentiments, we've had some really big wins over the last couple of years as an organization, and really with our community partners. We declared as a state racism a public health crisis, and formed a commission to really look at all of the disparities that are in our state, and then come to a place of setting policies and practices that shift that. And so just knowing that our state is willing to make a change, knowing that there is, you know, systemic racism that really has impacted our state, and looking at ways that we can support that, and ensure that individuals have access to care. And then another big win was really, and it ties to the Roe versus Wade, is this year we helped with other members and more or less community members to pass that community health workers be reimbursed through Medicaid, And that's a huge win for us. And it really just pushes towards understanding that health is not just a one thing. It's not just about going to the doctor or seeing a physician. It's so much more to that. And addressing the social determinants of health is one of the biggest things that we are fighting for. And so to have that big win of like knowing that we can have community health workers be addressed and doulas be certified, and all of those things are pushing towards like a more equitable health system. It's one of those wins, and it brings me joy, and it brings our team joy and our community members, really knowing that their voice and their advocacy can really have some change.
Yes, yes, it's so powerful to see how things change when you're in the room. That truly is what this conversation is about. Okay, so I am going to switch gears to some questions that we've got. We've got a whole bunch of questions coming in. My team is sharing them with me, so bear with me 1 second. Okay. One of the questions that we got in advance is around the issue of how reproductive health doesn't just affect cis women, but also affects trans men and individuals on all sides of the gender sexuality spectrum. How can we continue to make the fight for reproductive justice accessible and available to those who do not fit neatly into the cisgender heterosexual bucket so that they stay front and center in the dialogue?
I'll jump in. It's making sure they're at the table. One of the biggest things that we talk about is that when I talk about like a work group or collaboration or individuals, it's a space of making sure, looking around, who are we missing? And who is impacted by these changes, and making sure that their voices are a part of the solution, and understanding how they are marginalized as well. So that's a quick answer. I know we have a lot of questions that are coming in, but just making sure that we're taking it back and sharing that power.
Yes, 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 1000%.
I'm
Yes.
glad that, is working in the movement, ensuring that we're using inclusive language in what, how we're talking about these issues, making sure that we're not excluding folks because of that, that simple act of how we use the language, and really, rethinking our own structures as a movement that has always centered cisgendered women, and not talked about the specific experiences of folks who are trans or LGBTQ plus. Like I think we have a lot of that kind of internal work to do as well, and so I think that's another part of how we make this a better experience, and not only that, how we advocate strongly. One additional thing, recognizing the intersectionality, right, with the attacks on LGBTQ plus folks at the states, right, like that those issues are reproductive justice issues, and that they should be a part of what we care about and what we think about when we're advocating for change.
Yes. Thank you both for that. Okay, here's a question. I understand the power that states have in enacting change within the reproductive health sphere, but not so much the power of cities, schools, or counties. What are some elected positions that can allow me to take part in this fight? How do I get civically involved with the issue if I decide not to run at all?
I mean, obviously, school boards are a huge topic of conversation right now, because in many areas, certainly here in Michigan, they've frankly been taken over by people who are anti-reproductive rights, anti-LGBTQ, the social emotional learning. So school boards are a really, really tough place right now, but they are so necessary for us to keep in mind, because opponents of all of those things are paying attention and they are loading them up with candidates. And I mean, just using Michigan as an example, there is anti-abortion language in the boilerplate for our school aid budget. So having advocates on the school boards is very, very helpful in making sure that we can deal with how the state level policies do end up impacting places like our schools. City council, we had a clinic open up in part of my district, and city council made opening statements about, well, zoning wise, they're following the rules, there's nothing we can do, but we really encourage everybody to protest them constantly. And people did, and it's been awful for patients just trying to access basic healthcare. So having a city council that would never say something like that is hugely transformational. There are certainly roles for local governments, whether it be not trying to enact some policies, because some local governments do in fact enact local policies that are anti-reproductive rights, or just trying to intersect with the state level policies as well.
And I'll just add one other thing, is there's also boards and commissions that you can join, whether at the local, state level, where you can have an impact if you're actually not comfortable just yet for running, but making sure that that's a space where you can have your voice heard, and then attending. So as Representative said, if you're not ready to run for the office, but attending the city council meetings, the board of ed meetings, you are able to share 3 minutes at most places to talk about what's happening. Your voice, I always say your voice matters.
Oh, absolutely. And you know, I think it's an interesting segue we had a few questions come in from folks who I think are in states like Texas that are particularly hostile right now around this issue. And you can hear in the comments, I don't have one of the questions right in front of me right now, but you can hear in the comments, you know, if somebody's not, how can they be effective when something's highly partisan, highly hostile, if they're not themselves an expert? You know, there could be that hesitation there. I'm curious what advice that you have for somebody, and I know a lot of our community members feel this, as they care deeply about an issue and they are informed, but they question whether or not they are the voice, whether their voice should be the one that shows up, because are they an expert enough in this, especially in these moments when things are so charged?
So I hesitate to even like uplift any thought that you're not qualified enough to talk about any of this, because I think that we doubt ourselves so much about that. And the fact that there are folks on this meeting right now indicates to me that you are qualified enough. And the fact of the matter is, when I was knocking doors for the constitutional amendment proposal last year, I had a man tell me about how the gestation time for a human pregnancy was a solid year. And he did not once stop to think about whether or not he was qualified to make that wrong statement. So like, I worry that we judge ourselves too harshly. And the fact of the matter is, you don't have to be an expert on something for you to advocate with the person whose job it is to represent you. And I know that, yes, it is super partisan and it can be very, very difficult. But you know, emails, calls, those are one ways to make your voice heard. Coffee hours, town halls, and it doesn't have to be aggressive. If you go in level-headed, like I said, you don't have to know everything, because I guarantee you the person that you're talking to doesn't either. But going in person is sometimes really impactful, because it's much harder to ignore someone who is sitting in front of you and has taken time out of their day to come tell you that this thing matters to them, than it is to delete an email or not listen to a voicemail. That's one way that you can be really, really impactful and advocate.
So helpful to hear and so true. Okay, on that note, because I'm feeling super energized and I know folks are listening are too, we are going to transition to just quick closing statements. Before we do that, just two housekeeping items. One, we ask that you take just I think it's 2 minutes it takes, quick survey. This is new programming for She Should Run. We'd love to hear your thoughts about it. Miriam's dropping the link in the chat there. And two, we're going to continue the conversations on issues, not only the issue we're discussing today, but others throughout the summer and beyond. So please follow that link to get signed up for the ones that we know are already scheduled, which will also trigger for us to be able to tell you about the ones in the future. And with that, I would like to turn to Lupe. Actually, why don't you share your closing remarks?
I think, you know, what I'll say is that I want to echo a little bit about what Representative mentioned about being qualified or feeling qualified or being connected to this work. We're all experts in our stories, and we can, you know, we should be and can be sharing those. I think it's incredibly important right now, you know, speaking of storytelling, to talk to our family members, to talk to our friends about our lived experiences with these issues, to encourage others in our lives to have these same conversations. Like, that's how we move to destigmatize these issues, how we move to lift them up, how we make change. And so I think that that's one really important thing that folks can do right now. And no action is too small in other ways, right? Like signing up to be a part of a listserv, signing up to receive information, signing up for webinars like this is a step in getting involved and in driving forward for change. And then, of course, there are ways to be more deeply involved, and I encourage folks to join us at Latina Institute, to join She Should Run, to look for other ways to get involved in your communities. And this is the moment. I guess I'll just end with that. I think if there ever was a time, you've been thinking about it for a while, about when to get involved, when to jump in, this is the time. It's been time, but if you're feeling moved right now, please join us. We need you. We need our communities to come together now. We know we stand for these issues, and we just need to step up and speak out.
Absolutely. Aisha?
I would say research shows that women and those who identify as women don't run for office because they don't feel like they qualify, and or they felt that they have not been asked. And so I'm going to say, everyone that's on this call, I'm asking you to go ahead and step up and be that change. There are many mediocre people who are out here that run for office and win. And you, as shared, have that lived experience, you have experience, and you are capable and qualified to run. So I'm doing that ask, so never say that you haven't been asked. The other thing is making sure that you go out and educate yourself about different issues, specifically when it comes to running. Volunteer for a campaign, sign up for advocacy training, campaign training. Those are important. It's a space where you can learn more. And I deem myself as a political social worker. I didn't share that at the top of the call. There are many organizations and institutions that have training on how you can run for office, and or how you can just be a part of a person running. So you can be a treasurer, you can be a campaign manager, you can be all of these other things as you're deciding to run for office. And so again, make sure that you get yourself involved in some form or fashion, whether it's at the local, state, and federal level. Join a commission, join a board. And lastly, if you're looking for any training opportunities when it comes to campaign building, coalition building, and advocacy work, please feel free to reach out to us at HESCT.gov. Thank you so much.
Thank you, Aisha. Representative?
I just want to thank Aisha so much for that official ask for people, because as someone who was never asked by anyone to run for office, but just felt compelled, I would sit in rooms where people would say, on average, it takes women 7 times of being asked. I thought that I was out of my depth because no one had asked me. And having that call is so important. So Aisha, thank you for that. And I am also asking you, so count that as 2. If you're someone that feels the need to count to 7, you got 2 right here. But I'm so grateful for all of the panelists for bringing their expertise, and for She Should Run for bringing us all together. We're in such a pivotal moment in history, and the whole point of government is that it is represented by the people for the people. There is no box that anyone needs to fit in to run for office. And I think that government is best when it is more diverse, and when it has a variety of people from different backgrounds, with different careers, with different living situations, from different races, from different sexualities, like all of that. It is so important. So I trust me, from experience, I can understand getting stuck in our own heads and thinking that we're too much of this or not enough of something else. We need you. And the fact that you are on this webinar right now asking these very important and very, very thoughtful questions means that you are exactly the kind of person that we need to step up right now, whether that is officially running for office or whether that is just getting more involved in grassroots efforts. Regardless, it is all so crucial right now. This is such a pivotal moment. So thank you all for joining us and for having me.
Oh, I want to box up that energy. I hope everybody can and take that into your day. Lupe, Aisha, Representative, thank you so very much for your time. Thank you to all of our audience members. So much more to come. But if you're left with one thing today, it is you have been asked. You have been asked to consider your role in this. So thank you, everyone. Have a wonderful day.